Hey guys, this is Dr. Ahmed Ergin. I'm an endocrinologist and a diabetes educator. Now, today we are talking about something exciting, the vitamin that every diabetic should take. It's inexpensive, it's readily available. It is called thiamine or benfotiamine. So, we need to make sure that you guys have enough thiamine. Now, when I say thiamine, thiamine is a water-soluble vitamin. So it is not as good as absorbed, and you have to be taking this every day and so forth. But benfotiamine is a fat-soluble form of thiamine. Now, that's better because then you can absorb that better, and your body actually likes it better. Because think about it, your cells are all formed from cholesterol core, and basically we are a good chunk of fat. So fat-soluble vitamins, like vitamin D, for example, you can go without vitamin D for a long time, and your body will still have vitamin D because vitamin D is kind of dispersed in your body, in your fat cells. So that's like fat works like a storage. So anything that's fat-soluble is better absorbed from the intestine and is better stored as well. So as a result, benfotiamine is the way to go. A normal person will need anywhere from 1 to 4 milligram of the thiamine, and you can look up on the internet and they'll say, oh, well, eat salmon, eat meat, dairy, etc. They have a bunch of thiamine. Well, that's true, but not enough. You may have anywhere from 1 to 2 milligrams or 3 milligrams at most of thiamine in your diet, but if you are constantly deficient or you need more and more, then you need a supplement. Now, interestingly, of course, there have been a lot of studies in vitro, which means that they have done studies in cell cultures to see what happens to those cells in a laboratory environment. And they have identified that most cells, when they are fortified with thiamine or benfotiamine, they do much better in terms of their outcomes. So they basically simulate what's happening in the body in the laboratory environment, and they observe what happens to the cells. And they were able to observe, even in some rat studies, they were able to observe that the complication risk from high glucose goes down anywhere from 30% to 50%. Now, we give a lot of medications to diabetic patients to try to reduce the complications, but we don't talk about thiamine or benfotiamine as much. Something that's very cheap, like none of the pharmaceutical companies will invest millions of dollars. At drug development, we always complain about drug costs, but those drugs, they spend hundreds of millions of dollars to produce a drug that is safe and effective, and to prove that, there's a lot of resources poured into that. Now, benfotiamine being available in the market as over-the-counter, nobody is going to spend hundreds of millions of dollars that's already readily available over-the-counter. So, another application for thiamine is neuropathy. Even if you have neuropathy, even if you have complications, taking benfotiamine 600 milligrams will help you dramatically with your nerve pain as well. So it can also help prevent the progression of complications. So even if you have an eye disease right now, or neuropathy, or kidney disease, take benfotiamine. That's going to help you dramatically to prevent further damage. God forbid, ending up with dialysis or eye injections or a bunch of eye surgeries. And the worst case scenario is blindness. We don't want any of this on you guys. So we do our best with the pharmaceutical medications, diet and exercise, anything you can get your hands on to improve your diabetes care. But I think benfotiamine is a great way to supplement that. Now, I don't recommend every other supplement. Don't be a supplement junkie and go buy 20 supplements hoping that everything will help. You have to hear from your doctor. It has to be a reliable information. I wish you guys were going to PubMed and PubMed. That's most of the scientific articles are, and you will find a lot of scientific articles about benfotiamine if you want to do your own research as well.